name's John Holden. I'm a physical therapist in Sonoma, California. I'm going to show you how to do the perfect lunge. The reason I'm showing you is because I've looked at a bunch of them and I haven't seen one that emphasizes the points that I emphasize with my clients. When you do it correctly, it makes a huge difference. So, always do a pre-test and a post-test. How do you know if the lunge that you did gave you what you needed? So you check your flexibility. So you can check how tight is this in here, just get a feeling for it. You can check your neck, which is a huge component for me. So the neck should always be looser after you've done the lunge correctly. You can check your toe touch and just hang. How far do you go comfortably? And check. You can do a strength test to see if it changes your strength. And just come up and down and check left versus right for strength. Check a single leg squat and how strong are you on one side versus the other. After you do the lunge, it should be different if you did it correctly. If you do the lunge correctly, it's increasing your range of motion. It's opening up your back, opening up your hips, opening up your knees, and it opens up your neck. Very key component is the neck. If you don't relax the neck, you can still maintain that weakness in your lower extremity. So some people, not everybody, will have a neck component that gives their lower extremity weakness. And if you can increase that flexibility in the neck, the nerves will open up and you'll have the strength right away. Don't take my word for it, see it, because I've seen it a million times. So we, as physical therapists, we're trained to work on the area, and then we think, okay, if it's weak, maybe go to the back and help that. I've seen it 1,000 times. The neck will cause the weakness in the lower extremity and the back will be fine. So just see for yourself what's working and what's not. So the lunge is a simple exercise if done correctly. You want your knee to be at 90 degrees. This knee cannot come forward. As soon as it comes forward, you're adding stress up the chain. Your back heel goes straight up to the sky. So I'm in the starting position right here. And then as I go down, I go until I feel tightness. So right now I feel tightness in my right hip. But my body's relaxed. I'm not out like this. My neck is neutral but loose. So I'm able to turn it. And then I just felt something release, so now I can go a little bit lower. So I'm breathing and my whole upper body's relaxed. I'm not leaning forward. I'm not sticking my chest out. I'm slumped. And I'm totally, completely relaxed. All my weight's going straight down. And it just opened up again. And then I'm going to do the same thing on the other leg. So I get a big stance. My back heel goes straight up. This knee stays there. And right now I'm feeling the tightness right here. So you breathe. And you stay relaxed. Don't go further than you can relax. If I were to go all the way down, I would tighten up the chain and it wouldn't be good. So I feel it opening up and letting go. And then I check my range of motion. And you can tell I gained 3 or 4 inches. If I were to do a muscle test, I'd be strong on both sides. My neck right now, I can tell I gained a few degrees on my neck. So I know I did it correctly. And that's the whole point. Pre and post test with your lunges to know you're doing it correctly. Keep the neck relaxed. And don't go further than you can do it perfectly, because your body will relax into it and let you go down. I hope that helps.